Are you getting fed up with getting up multiple times at night to go for a pee? Is your stream slowing down and it seems to take you a lot longer to empty your bladder, or perhaps you even feel like you're not emptying your bladder at all? Sometimes men notice that they're rushing more to get to the toilet, and on occasions they don't make it there in time. If this is you or a friend of yours, it's possible that this video may explain some of what is going on. It's also possible that your specialist, your urologist, may have recommended to you an operation called a TURP or a TURP operation to try and help manage your urinary symptoms. Hi, my name is Dr. Charles Chabert. I'm a urologist and director of the Prostate Clinic located on the Gold Coast in Queensland, Australia. Please, if you get value from the video, consider giving it a thumbs up or subscribing to the channel. The aim of what I wanted to do today was to dive in and explain in a lot of depth for you the particulars of a TURP operation. What is the aim of the procedure? What's involved with the procedure? And more importantly, what can you expect in terms of outcomes from that surgery? And are there any side effects from that treatment? Please stick around to the end of the video and I'll highlight for you a couple of clinical scenarios of where men may get benefit from this surgery. So if we take a little step back, urinary symptoms can be caused by an enlarged prostate. You may recall, if you've seen some of our previous videos, that in essence the prostate is shaped a little bit like a donut. It sits underneath the bladder, and in the same shape as a donut, we pee through a hole in the middle of the prostate. As we get older, the prostate increases in size, putting pressure on the outlet pipe and causing a variety of urinary symptoms. A TURP operation, which at the prostate clinic really has been superseded by a green light laser prostatectomy, but a TURP operation basically is a very commonly performed procedure that is there to try and debulk the prostate, to unobstruct the bladder, and to try and improve urinary function. The way that the procedure is performed, it's done in hospital, and it can be done either with a spinal anesthetic or a general anesthetic. A spinal anesthetic involves a small little injection into the back that makes men numb from the waist down. The way that we do the procedure, in essence, it's by placing a telescopic camera through the urethra internally to visualize the prostate. An inspection of the bladder is also done at the same time. A resectoscope, which is a specialized instrument that allows us effectively to scrape away chips or pieces of tissue in such a way that we create a larger channel in the middle of the prostate. We do not remove the whole prostate, but we make the channel in the middle of the prostate larger. After the procedure, men have a catheter put in place, which is a plastic tube that enters through the urethra into the bladder, and for most men that is kept in place for a day or two. Let's start now, or continue, with the indications for having a TURP. For the majority of men, if they have urinary symptoms, the entry level really is to start with medication. So if medication works, great, men can stay on that for a longer period of time. If, however, urinary symptoms progress, get worse, despite the use of medication, that in itself would be an indication to proceed on to treatment. If a man cannot pee at all, that's called acute urinary retention. Those men are managed in the acute setting with a catheter, and then after discussion with their surgeon, a time is selected in due course to do the procedure. Also, if men have got recurrent urinary tract infections, if they have stones that form inside their bladder, that is related to chronic, long-standing blockage to the bladder. And also if there is kidney damage related to prolonged obstruction. The final indication really is if men have recurrent bleeding from their prostate. Now, usually men, when they have the TURP operation, they're in hospital for a couple of days. The catheter, as I said, is usually removed 1 or 2 days after surgery. And as long as men pass a trial of void, which is a process really through which we make sure that men are emptying their bladder and not retaining too much urine, men can then be discharged home thereafter. Men need to take it generally easy for a couple of weeks after surgery. Avoid straining, avoid golf, avoid climbing up ladders, avoid surfing or bike riding or running for several weeks, usually for around 4 to 6 weeks after the surgery. If you do too much too soon after surgery, the main risk is bleeding. So certainly be aware of that. Now, one of the benefits to a TURP operation is it does provide relatively early significant improvement in the way that men pee. And many of you may have heard of me discuss urinary symptoms or categorize urinary symptoms into two main groups. One is called the obstructive symptoms, which includes slow flow, hesitancy, taking a long time to pee and feeling that your bladder isn't quite empty. They're the obstructive symptoms. And the others are the storage or the irritative symptoms, and they're related to changes in the bladder. For the majority of men, it's the irritative symptoms that are the most annoying. They include getting up at night, rushing to the toilet, going more frequently. After a TURP operation, most men experience improvements in the obstructive symptoms first, and then gradually with time, and this can take 2, 3, 4 months after the surgery, and will really be dependent upon how long someone has been blocked for, how old they are, and the size and complexity of their prostate. So it can take a period of time for the rushing and the frequency to settle down. It's really important to be aware of that. Some men expect to be sleeping through the night, to pee like a racehorse, and to only need to go to pee once or twice through the day within a week after surgery. That doesn't happen. It takes time. All right, let's get to the common side effects following a TURP operation. Well, in the perioperative period, so short term after the surgery, very common to see blood in your urine. There can be stinging or burning when men pee, and it's very common to have some irritative symptoms, the rushing, the frequency for a period of time, as I've indicated. If we look more significantly, and a lot of guys are worried about what's their risk of incontinence and what's their risk to sexual function. So if we look at the risk of incontinence, well, to begin with, there are crudely two types of incontinence. One is called stress and the other one is called urge. Stress incontinence happens when the muscle that keeps you dry gets a bit bruised or damaged after surgery. That would require, if it did happen, that would require pelvic floor physiotherapy to regain strength in that muscle and regain control. That is a rare side effect following this surgery. It can happen, but it's not common at all. What is, however, more common is urge incontinence. That's a situation where you feel like you need to pee, you rush to the toilet, and some urine can come away before you make it to the loo. That is more common and almost always settles down after surgery. It's a product of time, and it's a product of your bladder adjusting to no longer being obstructed. If we look now at sexual dysfunction, well, sexual dysfunction is two things. It's changes in erections and it's changes in ejaculation. Just about every man will have changes to ejaculation. Men develop what's called retrograde ejaculation. You have an orgasm, but no fluid comes out. Expect that to happen if you have a TURP operation. Erectile dysfunction. Well, because of the way that a TURP operation is performed, in essence, electricity is placed through a wire, and that wire is pulled through prostate tissue to debulk and remove the obstruction. Sometimes the passage of electricity can be close to erectile nerves, and if that does happen, it is possible that erections can change. The reported incidence, the probability of this happening, is anywhere between around 10 to 20%. So that's something else to factor in when you are considering whether or not you think a TURP operation is appropriate for you. Look, I hope you found this video of benefit to you. Please, if you've got a story or a comment with regards a TURP operation, please leave it down in the comments below. We have had lots of comments and lots of men that have been sharing their stories with other videos of ours. It makes a huge difference for men to get some education and to get some insight, really, with what can happen with these various aspects to your prostate journey. Thanks for watching the video. I'll see you in the next one. Until that time, take care of your prostate.